All right, we're at 4 minutes after the hour, so I'm going to start. Welcome, everybody. I'm Amy Hagopian, based at the University of Washington in Seattle, and I want to welcome you on behalf of the Global Alliance on War, Conflict, and Health. This organization formally launched with a webinar in the summer of 2022 over Zoom, and we now have more than 100 member organizations from academia, humanitarian organizations, and journals. We also have a website where you can find information on how to join the Alliance yourself as an individual or with your organization. We look forward to creating working groups on our platform where you can find collaborators on war and health projects, so stay tuned for that. This is our 5th webinar in a series. The first was on explosive events in urban areas. The second was on health systems in the context of the war in Ukraine. The third was on America's footprint in wars in Africa. And in November, we had a session on the long legacy of nuclear weapons production and testing and lingering health harms, primarily in the Marshall Islands. Those recordings are all on our website if you'd like to look for those. I'd like to thank 4 people who made today's webinar possible. In addition to the participants themselves, Becky Brown is with Southampton University, which is our secretariat organization. Elsara Badri, who works from Mozambique, almost full-time on the Global Alliance. And most importantly, perhaps for today, is Stephanie Endo, who is an MPH student at George Washington University, and she does all the coordinating for these events. I'd also like to thank Samer Jabbour, my Global Alliance co-chair. Thanks today to my friend Barry Levy for moderating. He is serving as an adjunct professor of public health at Tufts University School of Medicine in Boston. He has spoken and written extensively on the public health effects of war, climate change, environmental and occupational hazards, and social justice. He has co-edited many books, including 2 editions of War and Public Health, and he recently wrote the book From Horror to Hope: Recognizing and Preventing the Health Impacts of War. Barry is a past president of the American Public Health Association. After today, our next webinar will be March 14th with Dr. Mohammed Al-Mahal of SAMA, the Sudanese American Medical Association, and Hashim Suleiman, who is an engineer now working in Qatar, who was Minister of Transportation during the civilian government. You'll see a poster for that event at the end of our webinar today. So this is organized as a webinar. Would you show the housekeeping slide, Stephanie? Yeah. So we'll use the Q&A function, enter your questions there, and Barry will harvest those during the Q&A session. The rest of us will go on cameras off and mute ourselves. We are recording today so that we can post the recording on our website. And if you have any technical issues that seem to be related to on our side, please use the Q&A feature to tell us about that. Thank you. And thank you, Barry, for moderating today.
Thank you, Amy, and good morning, everyone. Public health is what we as a society do collectively to assure the conditions in which people can be healthy. In contrast, war creates conditions in which people cannot be healthy. War leads to injury, disease, and premature death. It adversely affects mental health. War violates human rights, and war forcibly displaces populations. It damages civilian infrastructure. War contaminates the environment. It diverts resources, and it leads to more violence. I'm very pleased to introduce our speaker today, Dr. Yara Assi, who is an expert on these impacts of war. Her work in general focuses on health, human rights, and development in conflict-affected fragile settings. Yara is an assistant professor at the University of Central Florida in its School of Global Health Management and Informatics. She has been a Fulbright Scholar in the West Bank. She is currently a visiting scholar at Harvard's FXB Center for Health and Human Rights, where she is also co-director of the Palestine Program for Health and Human Rights. And in addition, she is a fellow at both the Arab Center, Washington, D.C., and the Foundation for Middle East Peace. Yara has written a new book, which indeed is being released today. It's very exciting. The book is entitled, and it's published by Johns Hopkins University Press. The book is entitled How War Kills: The Overlooked Threats to Our Health. In your book, Yara provides an extraordinary description of the impacts of war on health and the factors that contribute to these impacts. The book starts with a personal account that humanizes these issues and then covers several interwoven subjects from a public health perspective. These subjects include the direct and indirect impacts of war, sexual violence, attacks on healthcare, and the effects of war that are distant from the battlefield. The book shows that war may be seen as a contagious disease, and the book explores contributing causal factors, including racism, militarism, and economic exploitation. The book asks some tough questions like, how can regular everyday people permit and indeed justify the unjustifiable and unimaginable horrors of war? I had an opportunity to read the book last night, at least to start reading it for a couple of hours, and frankly, I couldn't put it down. It is so well written, so engaging, difficult subjects to read about, but so well written and so well researched. It's a real pleasure for me to introduce Dr. Yara Asi.
Thank you so much, Barry and Amy. Any of you in the audience who are familiar with War and Health recognize those two names, and it's such an honor to have you as part of this. It feels like such a real full circle moment for me. Be having kind of learned from your experiences and your articles and your books. And I see some familiar names in the audience. Thank you for coming, including my cousin, Tasneem. Hi, Tasneem. She's in the West Bank. Thank you for joining. And as Barry said, I'm basically going to talk through some parts of my new book. It's out today. I think Stephanie just put a link to Amazon, but it's also available at bookshop.com or .org if you choose independent booksellers instead. So I'm going to try to leave enough time for questions. And with the caveat, of course, that can't cover everything in the book, but I hope I'm going to hit the high notes. So if you will allow me just a moment of personal indulgence, as Barry said, the book starts with an anecdote about my life and why I'm in this work. And it is 100% safe to say that I would not be doing this if I was not Palestinian and did not grow up kind of witnessing what this long, slow, insidious war, for lack of a better term, can look like for people's lives, not just about bombings and tanks, and even though that's part of it, but just the day-to-day grind of living, trying to live in a place that is impossible. And so my entire trajectory into this work was from experience I had at this point almost a decade and a half ago, when an uncle of mine in the West Bank fell very ill. I use a pseudonym in the book, but this is me and him on his farm that I also talk about in Nablus. And he had a very treatable, easily diagnosable, but needed a lot of treatment illness. And he was admitted to the best hospital in the West Bank. And unfortunately, they were not able to help him. And it was really dire for a few weeks. Fortunately, he was able to secure a medical permit to go to a hospital in Israel, just less than an hour away, where he received world-class care and still lives, fortunately, to this day. And it really made me think how unnecessary all of this seemed. That it's not like we're talking about a disease or an ailment where there's still not a cure, or where we're trying to, figure out ways to deal with it. This was an ailment that we know how to treat. And he could have died simply because of the accident of his birth. And so this is what propelled my entire trajectory into looking at war as a public health problem. And the more and more I looked at it, I began to realize that it's not just my family in Palestine or families in Syria or Yemen or Ethiopia or Sudan or Ukraine or any of the many unfortunate number of places that have faced catastrophic war in recent decades, let alone the trajectory of history. But all of us are affected by war and militarism, even myself living, comfortably here in the United States, where I don't feel at active risk of warfare, and yet I am affected. So I kind of start in the book, obviously this is not a political science book, but there are a few terms we kind of have to wrap our heads around as we're addressing this topic. And the first is, what is war? And for those of you in, international humanitarian law, war is not actually a legal framework. We consider it armed conflict and various kinds of armed conflict, but colloquially, we use the term war typically to mean organized collective violence between two or more societies or within power structures within a society. So we might call that a civil war. And really the key here is that war is organized collective violence. It's not war if we don't see violence on the ground. We may call it tensions, we may call it other things, but we associate war with violence. And so then we need to understand what is violence. And this can seem kind of easy on the surface. Obviously, shooting someone is violent. Dropping a bomb on someone is violent. Hitting someone, sexually assaulting someone. These are all violence. And these are all present in warfare. But unfortunately, for too long, the political science literature kind of looked at these different forms of violence, including really mass violence like genocide and ethnic cleansing, as just kind of unfortunate side effects of war. And I think increasingly over especially the 20th century, where we saw both World War I and World War II, we started to realize that actually massive harm, especially to civilians, can be part of, if not a sole intention of a perpetrator. And so we need to start looking at violence as not just an unfortunate side effect, but as a tool. This is what war is. War is collective violence. And it is not just waged by tanks and guns, as I will address in a few slides, but it is a massive structure of oppression and of deprivation, and also of physical violence that manifests in war. And of course, violence is not limited to war. Violence exists in all societies to some degree. But when we think about war, we think about violence against a specific group of people, often because of where they live, what their religion is, their race, or some other characteristic. And so I'm going to start at the 20th century. I'm not going to start at the beginning of human history, even though I do try to address some of that in the book because we simply don't have time. But World War I really represented a sea change in how we saw violence from war. And this was not unnoticed by the physicians of the time. So we started to see more use of chemical weapons. We started to hear more overt statements of racism, including by the US president of the time. We started to see how prisoners of war were treated. We started to see what appeared to be intentional targeting of civilians. And we also saw many ailments and issues with soldiers who were now tasked to fight wars that looked very different than the localized skirmishes that we may have seen for thousands of years before. So the medical community paid attention. And one of my favorite quotes in the book is from a French physician in 1917 during World War I, talking at a conference about how do we manage this new kind of violence and injury on the human body because the weapons have advanced so much. And he said, we've perfected the art of killing. Why not the art of saving? And so we started to see in the public health community more calls for understanding violence and broadly warfare as a threat to health. Then, of course, just a few decades later, we see even more significantly disturbing mass atrocities in World War II. We see, of course, the Holocaust. We see treatment of the Japanese and the Chinese. We see internment of Japanese people in the United States. We see, the bombing of civilian towns. We see a whole host of just mass atrocities. And so once the war was finished, this is when we started to set up a lot of what we now kind of consider the international community, these kind of international frameworks and agencies and organizations. We get the United Nations and all of its agencies, the World Health Organization. We start to see the codification in the Geneva Conventions of protection of civilians, protection of health infrastructure, this kind of thing. So we tried to learn. We tried to see what had happened, and we tried to say never again, right? We saw this violence and we can't see this again. And this also sparked interest and attention from the medical community. And so we started seeing medical professionals, public health people, practitioners, really advocating for recognition of both warfare and violence as public health threats. And this was escalated during the Cold War, when the threat of nuclear war seemed quite real, and we were logistically thinking through how would we manage a nuclear war in the United States. Barry, your previous colleague, Victor Seidel, was a pioneer in this work and founded an organization with others about physicians specifically speaking out against nuclear war. They wrote articles, and these were not articles, these were articles asking really tough questions. Okay, there's a nuclear attack. What do we do? Where will the supplies be? How many people will be killed? How many medical professionals will be killed? These are the questions that they would actually have to wrestle with. And then they started posing these to the broader public, so that this was not just an abstract threat. Eventually, the World Health Assembly recognizes war and violence as a public health priority in 1966, and then we start seeing more academic literature applying a public health framework to violence and eventually war. So you may have heard of kind of primary, secondary, tertiary prevention in health terms, right? So primary prevention in the case of, let's say, smoking would be never smoking, not allowing smoking in certain areas. And then it escalates to the point where we're at tertiary prevention, where someone already has lung cancer and we're giving them treatment. Right now, continually, and especially in the mid-20th centuries, this is how we looked at war. It happened, and then we reacted to it. We were not proactive in preventing it, nor the health effects from it. And we started to see real shifts and criticism by public health and providers and activists on why are we not looking at this significant driver of mortality and disability through a public health lens. And so there's three main takeaways from this talk, and this is the first. This is the understanding that health is political. And too often, I think we as public health scholars, myself, physicians, or other kinds of practitioners are expected to give a primarily biomedical response to what are clearly political circumstances. So if someone starves to death in the 21st century, yes, they died by starvation, but can we say that that is not a political death? We have enough food. So policies are what are leading to these deaths. Unfortunately, too many still see the realm of public health and medicine as response, prescribing drugs, performing surgeries, not talking about gun control, not talking about how to prevent opioid use, not talking about militarism as a public health threat. No. You stay in your office, you prescribe the medicines, and kind of keep your hands off the politics. And increasingly, I think it's become more and more clear that health is political. It's actually politics on a grand scale, as has been said. And so we cannot disconnect our health from the politics of the society we live in. Now, public health has adapted this kind of framework of the social determinants of health, where we consider things like education and neighborhood and social support as factors in health. But what affects all of those things? It's armed conflict. It trickles down into every aspect of society. So why not see war as, in many ways, the ultimate determinant of health? And I just wanted to point to this quote from a piece written in the New England Journal of Medicine, one of the premier medical journals in 1962. You'll see Dr. Seidel here talking about why would physicians care about this political stuff. And this piece says, no single group is as deeply involved in and committed to the survival of mankind. No group is as accustomed to the labor of applying the practical solutions to life-threatening difficulties. And so they were not justifying, they were saying, no, this is part of our duties. Our job is to protect human life, prevent death, prevent health issues. We see war as a health threat and we will treat it appropriately. And so we start seeing a lot more literature after this time, more studies, and more just understanding of these issues. So I don't want to rely too much on numbers, but when I say, as I say many times in the book, that war is a #1 public health crisis, what do I mean by that? So in the 20th century, keeping in mind that these are estimates, an estimated 231 million people were either killed directly in warfare or allowed to die by human decision, which means by starvation, they died from infectious disease, they died from other forms of deprivation or oppression, through imprisonment, through torture. Well, that would be killed. But so we have at least 200 million. There are some estimates that are in the upper hundreds of millions. There are estimates greater than this, but hundreds of millions of people in the 20th century were killed or allowed to die by warfare. A lot of people quibble with those numbers, though, because, you know, this was a long time ago and it's much harder to count. And how accurate are they? Well, since just 9/11, which was just 23 years ago, we recognize at least 430,000 civilians died violent deaths as a result of post 9/11 wars. So ostensibly, this is data and statistics that are more trustworthy, we might say, even though it is very hard to count these deaths in war zones. An estimated 3.6 to 3.8 million more people on top of that 400,000 died indirectly in post-conflict war zones, died because their hospital was bombed, died because they had no access to pharmaceuticals, because they had no clean water, because they got cholera, because there was no adequate sanitation, any number of ways. So you can see here that as disturbing as active violence is, and as deadly as it is, many, many, many more people die from indirect causes of war. And that includes, of course, the post 9/11 period and what we're seeing today in Gaza, quite frankly. 360 million people in the world need humanitarian assistance. This was from 2023. This is a 30% increase from 2022. So it's important to recognize that while we may have the sense that war is kind of receding and is now more localized, there are actually hundreds of millions of people affected by war and armed conflict to some degree or another. And the United Nations says just to meet the needs of these people, they will need $46 billion in 2024. In 2023, only just over 20% of what the UN needed was actually funded. So we will not get this amount of money. At the same time, the sales of US military equipment to foreign governments in 2023 rose 16% to a record $238 billion in 1 year. So we can see that, you know, there's plenty of money being made. There's plenty of money to go around. It just doesn't seem to be going to the people affected by war, but the people who like to start them. So this is the second main takeaway, which is that war kills in many ways. And I kind of alluded to this by looking at the numbers of direct versus indirect deaths in the post 9/11 wars. There's some great data for that on the Costs of War project hosted at Brown University that I encourage you all to read. So I'm going to quickly skim through these, even though these obviously take up a good chunk of the book. So there's, of course, collective direct violence. This is kind of what we think of as warfare. This is the pictures we see on the news. So this is violence caused by conventional weapons like bombs. Bombs, of course, can be launched from planes. We call those airstrikes. Bombs have changed over time. They're supposed to have more precision now, but we have evidence of attempted bombings as far back as the 19th century, where people dropped munitions from hot air balloons over other populations. Landmines and cluster munitions we see less frequently. These have been banned. Their use has been banned, although they still exist, and many that were planted decades ago are still there, and thousands of people still die or are injured every year from old landmines that haven't been cleared. Because of the indiscriminate nature of these forms of weapons, they have been banned. Of course, small arms like guns. What surprised me in researching this book is that most guns in the world are actually owned by civilians, but obviously they play a major role in warfare. Increasingly, and especially in our post 9/11 reality, we've seen the use of unmanned aerial vehicles or drones. Drones have kind of been sold as this more humane form of warfare, where you don't actually have to get a soldier on the ground. You can have someone comfortably sitting in a base in the United States or somewhere else and controlling a drone as either a surveillance or armed drone. We saw a lot of drone strikes in the early 2000s, escalated during the Obama administration, killed thousands, if not tens of thousands of civilians, and often missed their intended target, which I talk about frequently in the book. And increasingly, we're seeing this use of less lethal, they're called non-lethal, but we call them less lethal weapons like rubber bullets, tear gas, that are used primarily for crowd control, but can and do kill and harm people. And we see this actually used domestically, and sold to authoritarian regimes around the world. I can't imagine what they're doing with them. Then, of course, there's weapons of mass destruction. So we have Dick Cheney to thank for forcing this word upon our everyday language. So these are all banned, the use of these weapons. Conventional weapons, as long as you don't trade them illegally, or in the case of landmines and cluster munitions, because they're indiscriminate, use those at all. Conventional weapons are just fine and legal. Weapons of mass destruction, which includes chemical and biological weapons like anthrax, and like any number of chemical weapons. We saw this obviously in Vietnam War. This was a large animating factor behind people losing faith in that war. And of course, nuclear weapons, which have only been used twice in warfare, both times by the United States, famously against Japan at World War II. However, many countries hold on to their stockpiles, and the threat of use of nuclear weapons animates a lot of modern warfare and this kind of what is euphemistically called saber rattling, which is basically just threatening each other with violence for political means. I also talk in the book about crimes against humanity, ethnic cleansing, sorry, typo, and genocide. So these don't require a specific kind of weapon or even a specific kind of crime, but they are collective forms of violence against specific groups of people. So this can include crimes against humanity, torture, mass incarceration, mass rape campaigns, which we've seen in war. Then we have ethnic cleansing and genocide. And interestingly, even before the current situation, I talk about genocide in the book and about how loath state actors have ever been to qualify anything as a genocide, because unlike ethnic cleansing, genocide has legal accountability mechanisms that must be triggered, many of which would probably affect enablers of wars, i.e. those who sell weapons and have otherwise protect perpetrators diplomatically or politically. And so ethnic cleansing is often used in the place of genocide because it is more of a colloquial term. And so I think moving forward, some of our questions need to be, how are we supposed to enforce the mechanisms against crimes against humanity, genocide, if we're unwilling to call things this? I have an entire chapter talking about interpersonal and self-directed violence. And what's interesting is that these do not follow a typical trajectory in warfare, but they do and can cause significant, again, harm, disability, injury, and death. So many studies around the world have shown that in active war zones, rates of domestic violence, especially violence against women, increase. And there's many potential mechanisms for this: increased stress and deprivation. Men who leave the battlefield and then return home are more likely potentially to abuse the people in their home. Violence against children, there's fewer studies simply because this is hard data to capture, even in our in developed countries. Obviously, people don't want to admit that they abuse their child, and children are trained not to admit that they are being abused. But there are some studies on this. And interestingly, they show that a child's well-being in the war environment has much more to do with their relationship with their parent and their parent's treatment of them than their actual exposure to war-related trauma. So a child who is with a parent who is able to be supportive, loving, nurturing, even if they are unable to properly feed the child or there's other forms of deprivation, will do better than a child who, because of war-related stress, perhaps their parent is abusive or neglectful. And there's some really interesting research in the book that talks about the different factors that affect how a parent may treat their child in the war environment. Perhaps the type of violence that we have the least data about globally is elder abuse. There is evidence of elder abuse, again, in all populations. In the war environment, we're more likely to see it in terms of deprivation. So you have examples in the literature of a family who needs to flee, who needs to escape. There is an elder left behind who cannot travel, and that elder may be left behind. Because elders are less likely to work or have access to their own money, other forms of elder abuse include not giving them money or access to resources. We need a lot more study on elder abuse, especially in fragile environments. And then lastly, I talk about self-directed violence. And this has a really interesting literature base that I just don't have the time to get into, but there are many studies that show that in war-affected environments, rates of suicide and self-harm actually decrease. And there are some interesting sociological mechanisms that can explain that. So people feel more of a sense of community because they feel like they're being targeted together. They may feel that preserving their life is valuable in such a situation. On the other hand, we have seen increased rates of either suicide or suicidal ideation, of course, in Nazi and Soviet concentration camps. And we also hear them anecdotally from Rohingya who are being asked to return to Myanmar and other very vulnerable populations who at times feel very hopeless. So in 2020, actually, the UN issued an alert that they were seeing an increase of suicide rates in the Gaza Strip because of economic deprivation and lack of hope. So interesting data there. And again, another area that really needs a lot of study. And this is something you'll hear me say a lot. So we need a lot more studies on all aspects of war and health. There is so much valuable information that we simply don't know. I have a chapter in the book about structural violence, and what I really focus on, so structural violence is unlike direct violence, which is there is an actor or actors and there is a victim or victims, and we can kind of trace the line between them. Someone is shot, someone is hit, someone is affected by, in a home that was bombed. Structural violence does not often have one actor. In fact, many forms of structural violence are legalized. They are on the books. They are perpetrated and enabled by governments and by legal systems in many cases. So this is a really interesting facet. I talk in this chapter a lot about siege warfare and embargo. I talk about Cuba. And I also talk about, of course, the longest blockade in modern times, which was the Gaza Strip, and how that had affected health outcomes. And I also talk about the persistence of poverty more broadly, and especially how it is both a byproduct of and an instigator of armed conflict. This has been such a huge topic in recent years, spearheaded in part by one of our colleagues, Barry and Amy Leonard Rubenstein, who's written a lot about attacks on healthcare. And so I won't belabor this point, but we are seeing a really distressing trend of antagonistic actors increasingly seemingly attacking health facilities, targeting health workers, kidnapping health workers, and all using it under the guise of a potential security threat. Bashar al-Assad in Syria broke all records in terms of attacks on healthcare after 2011. And even though received multiple condemnations, there was even a UNGA resolution passed banning this. It persists. And of course, now we're seeing it frequently. We saw it in Ukraine and we see it today in the Gaza Strip. So this is a layer where we are not just seeing no accountability, but the fragile guardrails that did exist, we are seeing slowly eroded over time. So let's talk a little bit about health outcomes. And I have kind of 4 distinct populations that I look at in the book. Obviously, I talk about the health of those in war zones, and a lot of this is inspired by the work of Barry and others. War affects health on every possible level. It is not just the injuries, the amputations, the bloody faces, as hard as that is to reconcile, to process when you see these images. But increasingly, people will die and do die from other forms of violence. Lack of food. We're seeing now in the Gaza Strip mass starvation, the UN is warning, and water insecurity. So not just lack of access to water, but lack of access to clean water. This is why we see many infectious disease outbreaks from waterborne illness in these situations. People are crowded, they have access to dirty water, and this is what happens. Infectious disease spread in general is a significant, highly preventable, highly treatable, but often deadly health outcome in the war zone. And of course, right now, in war zones, children aren't getting their regular vaccinations. So we saw polio and measles outbreaks in Syria, and health experts are warning about similar potential in the Gaza Strip. Barry mentioned environmental exposure. It can't be healthy to be surrounded by munitions and exploded sanitation and water treatment facilities and having sewage running in the streets. We know that's not healthy. We haven't even begun to quantify what does this mean for the human body. There was some effort to investigate the effects of burn pits on actually US service members. And even that was stymied by the Pentagon, even though there was an expose in the New York Times. We see high rates of non-communicable diseases in war zones. People are stressed. There's a lot of heart attacks, and people that live in these areas, as you can imagine, don't have the best health promotion efforts. So we see increased rates of smoking and increased rates of eating, sugary foods, processed foods, often because fresh food is not available. And we could do a whole lecture on the mental health outcomes of war. So even for those who emerge with their limbs intact and few physical injuries, everyone in a war zone's mental health is affected. And the way we pathologize these mental injuries, I think we need to reconsider, because when we tell people in a war zone that they have mental health issues, they have PTSD, what we're saying is the problem is in you. The problem is not in your surroundings. When the reality is these people are having very normal reactions to very abnormal circumstances. How do we deal with that in the decades to come? Of course, I address the special considerations for refugees and internally displaced people. Internally displaced people have fled their homes, but they have not left their country. And so sometimes they are still very close to the violence that caused them to flee. And many studies have shown worse health outcomes for IDPs, actually, than refugees that have made it to host countries, even if the host country is not particularly welcoming. And I really did not want to ignore the health of active service members and veterans and how it is neglected. I talk a lot about the US treatment of veterans and how we always have enough money to spend on the weapons that these soldiers are expected to use, but we've had times where soldiers had to pay for their own helmets or were not eligible for VA services upon returning after service. Many of these people have lifelong health needs. So this will be one of the last points I want to make, which is what about the rest of us? This is kind of, I think, my biggest argument in this book is that it's not just people in Gaza, Syria, Ukraine, Ethiopia, Sudan. It's us. And by us, I mean those of us living in developed, quote unquote, stable environments. This is a photo. You can see a CVS pharmacy in the back. This is from downtown Los Angeles. This is not from Gaza. This is in the US. Why do our police look like this? And it is because we live in a militarized culture that has defined security as what this is: guns and helmets and mesh gates, and I'm sure they're on some sort of crazy looking vehicle. This is what we've said security is. We've ignored everything else that makes us healthy. And look what we've gotten from it. Look at the life of the US, the richest country in the history of humanity. And we are seeing a dip in the most basic measure of health outcomes, which is life expectancy. And yes, COVID had something to do with that, but the dip started before, and people attributed it to the opioid crisis, deaths of despair, whatever it is. This is a crisis. And not one that I hear being prioritized at all. And how does this happen? Well, look at our supposedly, this is a Democratic president and supposedly has other things on the mind besides the military. And yet the proposed budget for 2022, half of our country's budget goes to the military. Everything else that we care about, literally everything, is squeezed into this little pie. And then if you include veterans benefits here, it's even smaller. 5% of spending on health, 3% spending on transportation. What do we get from this except the privilege of seeing our money used to kill some of the poorest people in the world? I have a chapter on the beneficiaries of war. It's the typical actors you would expect. Obviously, the arms industry, this is their business, right? McDonald's makes money when people want cheeseburgers, and Marlboro makes money when people want to smoke, and arms manufacturers make money when people want to go to war. It's not difficult to understand. It's only enforceable by the political stakeholders who see the arms industry for many, many, many reasons that I talk about in the book as part and parcel of their political drive as well, especially politicians who have or arms manufacturers in their communities. They are very unwilling to address this. Racists love war, not surprisingly. It covers up a whole host of lack of ideas, and it's easy to say, look at this other group that's not like us. Shouldn't we kill them? This is why we see dehumanizing language. This is why we see people called human animals. Because you have to, as Barry, you say, I ask early in the book, how can regular people justify these acts of cruelty to others? And I would argue much of it is because they are others. They're othered. They're not human like us. And so what happens to them might be sad, but it's inevitable. People just think of, especially in the Middle East, war is just a thing that happens there. It's, like the sun rising and setting. It's just a war-filled place. And there's, deep racism entrenched with that. And the media benefits. And I don't necessarily argue that many in the media want war, although I believe some certainly do, but that they want access. And so they're unwilling to present critical coverage of politicians and political decisions because they want to be able to go to cocktail parties with them later and book them on their show the next Sunday. And so we get the privilege of headlines like these. U.S. approves massive arms deal to Saudi Arabia and the UAE to counter Iran. What you're not told is that by countering Iran, they're bombing the poorest country in the world, Yemen. Records of arms sales during the Rwandan genocide, and of course, ongoing arms sales to Israel as they destroy the Gaza Strip. So this is the last point I want to make, which is that war is not inevitable. And by saying that we can't end all war, we're often letting ourselves off the hook for doing anything at all. And this is the last chapter of the book. So talking about what is human security. Shouldn't it include food, water, housing, and not just having new fancy drones? We have plenty of accountability mechanisms in these international guardrails that we've established. We do a terrible job of enforcing them. Let's start with that. We need to challenge the role of the arms industry. We need to support study and scholarship on linking war and militarism to health and well-being. And I think we need to challenge the justifications for war. We had the very same voices pushing us into war in Iraq and Afghanistan. Now they want us to go to war with Iran and China. And meanwhile, and they're never questioned, they still get to write op-eds in the New York Times. Meanwhile, those who oppose war are seen as on the fringe, unrealistic, not pragmatists, don't really understand how the world works. And I just don't think that that's accurate. And I want to end on this slide. Why do we go to war? Did we go to war to save Afghan women? Did we do that? Were we greeted as liberators after 9/11 anywhere? And did we find and destroy these weapons of mass destruction? None of this was true. None of this happened. Afghan women are probably worse off than they were before we bombed and occupied their country. So I want to end on this slide just to say we can do differently. And for not just the sake of those people, but for all of us, we must. Thank you.
Thank you for an extraordinary talk. This is really incredible, so much information that you covered in such a short period of time and so well. I want to ask the first question picking up on what you said about accountability. And would you say some more about the impunity that people like Vladimir Putin and other, aggressors have, and
Right.
what more can be done, realistically, well, even unrealistically, what can be done to make leaders who wage war, particularly war against civilians, how do we make them more accountable?
Well,
Wow.
this is the question of our time, right? I mean, I think all of us see this and recognize it. And I mean, there are entire news shows whose premise is playing the clip of a world leader criticizing one war and then playing a clip of a clip of a leader enabling another war. There's no consistency in this. There's very little questioning. Everyone is expected to kind of fall in line. And something that I say in the book is kind of like, do you love your country? Are you a patriot? If so, then you must support your country going to war at every possible avenue. And so I think that's a mind shift that needs to change. And I also think, it's unfortunately not complicated what needs to happen. We have mechanisms. We have an International Criminal Court. We have the ICJ. We have the Security Council. The main barriers is quote unquote, the developed world that does not wish to either implicate themselves or cause economic problems, especially to countries that we sell arms to. I think the previous president of MSF, Joanne Liu, said that countries and enforcing mechanisms are too polite or too afraid. I think she was being very nice when she said that. But I think that we simply have gotten used to this culture of impunity. I don't know how to get past it. And I really hope that this book sparks a conversation about why do we accept this, as Amy has said in a previous work of hers, as war as background noise that is just expected to happen. There's that New Yorker cartoon that shows two, I think, army people in a military plane, and one is asking the other, so is this your first reelection campaign? Like, we just kind of understand that this is something that countries do, and the more powerful you are, the more you're willing to do it. So I think it's both, we need to actually enforce what we say we believe in, what we say our values are, and we need to shift our understanding of what patriotism and of what being a good steward of world power actually means.
Mm.
We have a question from one of the attendees today, from Araya, who points out that attacks on healthcare are considered war crimes and
Yes.
wonders why they are not considered crimes against humanity. I'm wondering if you'd say more about not only that specific question, but attacks on healthcare.
Yeah, this is a great question. And I think this has confounded many humanitarian agencies. Of all red lines to exist, how can we not all agree that bombing hospitals and bombing ambulances and killing doctors and nurses working in unimaginable conditions is acceptable? Unfortunately, the good faith is often attributed to the perpetrator. We allow the perpetrator to simply say there was a military or security reason to do this, or we often hear, such as when the US attacked the hospital in Kunduz, Afghanistan, despite the attack lasting for, I believe, more than 30 minutes, that it was an accident and they were really sorry that that happened, and they would really do their best to make sure it didn't happen again. And I think maybe there was a few reprimands within the US military, within the US military that was involved with that. So, what this goes back to your first question, by not enforcing accountability, by allowing impunity, we said, we're okay with this. If you can give us a good enough excuse so that we don't have to deal with this, we are fine with it. I feel like that's a really untenable position, and I really worry about if we're allowing the perpetrator to define what is and isn't okay for them to do, I'm not sure we're going to like the precedent that that sets. And this should be, again, one of those guardrails that is not breached, or at the very least, there must be a preponderance of evidence brought to involve any health facility in any way. We didn't do that. We don't do that. We don't do that when we do it. By we, I mean the United States, and we don't do it when our allies do it, but we really like to criticize it when our antagonists do it. So, for example, Russia has been roundly criticized for bombing hospitals in Ukraine, while Israel bombs hospitals in the Gaza Strip, and it's, well, we're waiting for the evidence, we'll just see. This kind of inconsistency shows that if it works for the major powers, it's okay, no matter what it is. And so this is, I think, why Len and others have really focused on this issue, because it shows such a stark, unjustifiable failure of international norms and guidelines and accountability. And yet it persists.
And so I have a final question, and that's this. And you talked some about the indirect health effects of war in terms of affecting food and water systems, destruction of other infrastructure. I'm wondering if you would say more about that, particularly as it pertains to the situation in Gaza right now. And as you point out, there's a lot of coverage, and appropriately, there's a lot of coverage of the explosive weapons and the injuries and deaths that causes, but so little coverage of the impending humanitarian catastrophe that may be occurring. Right. I'm wondering if you would say more about that, and also the lack of coverage of that issue.
Yes. So thanks, Barry, for letting me end on this. I think especially in the first few weeks, the world was gripped by, I don't even have words to describe some of these images. Just horrific, unimaginable. And it's very gripping. It stirs emotion in you. Especially if it's a child or an elder, or a mother wailing for her dead child. You cannot help but feel moved. It's tangible. You can see it. Unfortunately, a statistical chart showing starvation rates over the next year does not stir the same level of emotion. It's very abstract. It feels disconnected from the war itself. It's like there's a war and then there's starvation. It's not actually seen as going together. I argue not just in Gaza, but elsewhere, it should be. So we're now at about 30,000 dead in the Gaza Strip, 70% of whom are estimated to be women, elderly, and children. And yet a global health expert in the UK, by extrapolating from previous studies of IDPs and refugees, estimated that in current conditions, up to 250,000 could die from disease, starvation, lack of water, lack of healthcare in just the coming year. Now, of course, this is a prediction. It could go either way depending on the trajectory of the war, but it just shows that the deterioration of conditions that is presented by warfare and what we're seeing in the Gaza Strip, which is an utter destruction of homes, bakeries, shops, factories, water treatment facilities, electrical and internet infrastructure. Every condition needed for life is being destroyed. We've heard there are maybe up to 19,000 unaccompanied children because their parents have been killed or are missing. What is their fate? We saw pictures of maybe a 6-month-old child that had both limbs amputated. This is a child that survived. This is a quote unquote lucky child. What is the fate of that child over their lifetime? And so I think it's hard to find a more visceral example of not just the ugliness of direct warfare, but how indirect violence and the deaths and disability that will result from that, while being more deadly, while having, a higher death toll likely, and has in previous wars. We have great examples of this. More people are estimated to have died in Syria from lack of health care than from airstrikes. And Assad was not shy about basically bombing everything. And we're seeing that in Gaza today. And so I think this is a perfect example of how, by siloing war as just the thing that drops from the sky or is only something that is perpetrated by someone in a military uniform. We have flattened the experience of civilians in these populations, and so we have ignored so many mechanisms that could potentially help them. If there's any positive to come out of this horrific, unprecedented tragedy, I hope that this connects the dots for more people, both about what life in the war environment is like, but also how all of the sudden the US had $14 billion to send to this war effort while, you know, infrastructure is crumbling, life expectancy is decreasing, et cetera, and so on. All of us are affected by this. If we can just pull that out of this experience and prevent this from happening again, how good would that be?
Thank you for an extraordinary presentation. Thank you. Amy?
Thank you, Barry.
And thank you, Yara, for producing this wonderful book and this great talk. I'm really enjoying reading this book. I encourage you all to order it. Thank you to the 100 people who came today. Thank you to my co-organizers for the Global Alliance on War, Conflict, and Health. And we look forward to seeing you March 14th for our webinar on Sudan, where there was a wonderful, an amazing revolutionary effort that is now ending in tragedy. And it's important for us to monitor these more obscure wars that get less attention. Thank you again so much to all of you for coming, and we'll see you in March.
Thank you, everyone. I appreciate you coming. Thank you, Barry, Amy, Stephanie, and everybody who made this happen. I appreciate it.